Well, African Americans are actually dying from coronavirus at an alarming rate. And now organizers in the Valley are looking for a solution. Kanisha Dees has the latest.
52% of the Black demographic confirmed with COVID-19 in Alabama have died. However, organizers say overcoming this health disparity starts with education to all, including doctors. African Americans have been more prone to the virus due to underlying health conditions such as asthma, diabetes, and hypertension.
In communities where minorities are the majority, policies and decisions are not necessarily always made to benefit those particular communities.
United Women of Color founder Angela Curry says this issue is systemic. Tiffany Jordan and Dell Smith agree and say those underlying health conditions haven't been treated in the community. Both are co-founders of a Huntsville genetic research company, Acclinate.
And so you've had a pandemic, a silent pandemic that was there, and now all of a sudden we have this public pandemic with COVID-19. And when you combine those two together within the African American community, it is really devastating.
Smith and Jordan say a solution is to provide diverse data, not just a one-size-fits-all.
The only conversation we need to be having right now are what are these underlying health conditions and how can we improve and make sure that everyone has equal access to drugs that work in their bodies, and of course now with COVID-19 to proper testing.
They've partnered with another local research company, RippleWorks.
Acclinate, our strength is in our ability to educate and engage minority populations. And RippleWorks, their strength lies in their ability to collect and analyze data.
So we're all changing and this industry is advancing, but we have to catch up. And the time is now. There's no better opportunity.
The Alabama Department of Public Health acknowledges this crisis and says that they will continue to address this health disparity and beyond. Putting the Valley first, Kanisha Dees, WZDX News.